I think it's really important, Kristin, to kind of share, why is it beneficial to exercise when you have metastatic breast cancer?
Yeah, I think exercise is really an important part of a cancer journey. And trying to help people improve their quality of life really helps with mood, anxiety, depression, those kind of symptoms, and also really helps to keep muscles strong, heart, cardiovascular system working well. And so I think that makes it easier for you to do all the activities that you want to do in your day. And so I think those are the key pieces that it really is so beneficial for people for those kind of reasons.
And I know that, these bone metastasis recommendations were, several years in the making. How did you get started to create the recommendations? Like, where did the bone mets piece specifically come in? Can you give us some framework there?
Yeah. So what we were realizing is that a lot of the people we were working with who had metastatic disease and bone metastases were saying that they knew they should be active. They just didn't know what to do. They were worried about what was safe for them. They didn't know who to ask about that. And so we recognized that that was a group that we weren't serving with all the research we had done so far. So where did we start? We started with just taking a survey of some of the physicians who work in the Canadian healthcare system where I work around what they thought about exercise for people with bone metastases, what questions they had, as well as nurse practitioners. And really what came out is that generally people thought exercise was good, but they just didn't really know what to recommend themselves. As an oncology provider, they were comfortable with the oncology piece, but they didn't know what to say about exercise. And then there was a real bit gap in terms of knowing where to send people. They didn't know where physical therapy services were. In a lot of cases, they may not be within the oncology setting that they work in. What was exercise professionals, who they were. And so that really gave us a framework of, okay, what questions do we need to answer? Then we did a systematic review, like everyone does in the research world, what's all the available information. And so we really looked at, was exercise for people with bone metastases safe? Did they have any sort of adverse events, things like a fracture or some other type of poor outcome? And, what did those programs look like? And basically what we saw from the literature is that there were fewer studies in people with bone metastases, so we needed more research, but the research that was available showed that it was safe. There were not any adverse events like fractures, other than a group who were playing soccer in men with prostate cancer in Denmark, and all of the fractures they had to do with playing soccer. It wasn't at the site of any bone metastases.
I remember that research discussion. We had very detailed discussions around men playing soccer, so maybe we shouldn't recommend it. So for the audience, yeah. Maybe not.
Well, we'll get to that. You can have those conversations to decide if it's right for you. Yes. And women playing soccer, they just weren't in this particular study. And then the other piece was that most of the research projects had some element of supervised activity. So they had a little bit of teaching about safe movements, how to progress exercise. So that was a key piece, that the people who had been in these studies that we showed were safe had worked with an exercise professional and did it in a supervised setting. So that's what we learned. So from there, Sami, you were part of the team. We brought together experts from around the world to really have a whole conversation about, is exercise safe? How do we ensure that we give people the right recommendations? And then how do we sort of put those recommendations out into the world so they're usable?
And I think you bring up such an interesting piece, Kristin, that is, oncologists aren't against it, but don't know how to recommend it. And I think that is one of the struggles, that for our patient population, they don't even know how to have the conversation. I'm not saying you shouldn't talk to your physician about exercise. I think it's really essential, and we've continued to do this work and will continue to do this. Talk to your physician and not just ask them, should I exercise, but give them the framework of saying, I'm really wanting to exercise. These are things that I want to feel better. I want to get stronger. These are my goals. But ask your physician or your oncology team about any concerns they have related to exercise for you, medication side effects. Would you be more likely to experience dizziness, which of course can be really concerning when you're wanting to exercise. We don't want you to fall, right? That's one of the main things. So I think having the conversation, being very specific to your situation, again, related to bone metastasis, but also maybe other areas of metastasis or medications that you're on, rather than asking, should you, ask a little bit more information about, is there anything I need to be concerned with? And then, do you know of somebody that I could be referred to, whether that is a physical therapist, occupational therapist, certified cancer exercise professional? They may have a resource. If not, those are some of those resources that we'll provide for you, ideally after the program today. So I'm also curious to know as we've done this research and we've published it, which has been just over a year now, is the feedback that you're hearing? Are we still identifying gaps that we need to focus on, things that we need to kind of bring together between the research and also our patient population?
Yeah, it's a great question. What we actually got was an additional grant to do knowledge translation. So to take those recommendations and try and make them usable. The feedback we've got in our focus groups with people living with bone metastases, exercise professionals, and physiotherapists and occupational therapists, which is what we call them in Canada, sorry, physical therapists, as well as with the oncology providers. So that's radiation oncologists, medical oncologists, the nurse practitioners, everybody. The feedback we're getting is they want something, a one-pager patient handout that has the key recommendations and a little bit of tips and tricks for the patient to actually be able to start those conversations with their providers. So all the things you're talking about, like I would like to exercise, what's right for me? If there are medications I need to be concerned about? Is the location of my bone metastases a problem? Is how that's being managed? Is there a medication plan or other treatment plans for the bone metastases site that should be part of the discussion? So I think that's the one big piece. The other big piece feedback we got was about professional development for exercise professionals, whether that's certified cancer exercise specialists or physiotherapist, physical therapists, occupational therapists. They just want to know a little bit more, that they are comfortable working with this group, but they really wanted to just get a bit more of the medical oncology, radiation oncology piece to really understand how to have those conversations with the providers really effectively for this population. That's a little bit potentially more complicated than some others they may have seen. And the last piece was that we had to come up with fun videos. Everyone wanted a one-stop shop that had all the information in one place. So we are working on that. It's not ready yet, but if it is, I'll certainly reach out to this organization to make sure that you are all well aware of where that lives. But I think the key piece was having how to facilitate that conversation between the exercise professionals, the providers, and the people living with bone metastases, so that everyone is having a collaborative discussion. What are the goals? How are we going to achieve this? Is there any other safety considerations?
And I think that, that you're showing people are excited about it, but I think it's really important to realize that we all say physical activity and exercise, everybody knows what to do. And I think that what we realize is that most people don't know what to do on a day-to-day basis anyway. You add cancer to that mix and then metastatic cancer, and that question becomes even more muddled. So one of the things that I'm really focused on when I talk to both clinicians and patients is, listen, something is better than nothing. Trying to move more is better. But it is really essential to think about when you are beginning an exercise program, always start with an attitude of leaving a little gas in the tank. So if you're new to exercise, don't feel you have to go out today, tomorrow, this week, and meet those recommendations. Start with 5 minutes. Do your activities of daily living, but try to find an exercise that can be complementary or enhance those kinds of day-to-day activities. So as an example, if you're noticing that your upper body is really weak, adding something like countertop push-ups, even if you have bone metastasis in some of those areas where the chest may be affected, is a great way to build strength. You could do 10 of those at one time. You're getting a little bit of exercise, but not too much. And so some of these really simple home-based strategies can be really useful. Ideally, we suggest, and the recommendations reiterated, supervised exercise is the gold standard for someone with bone metastasis, because it is important for you to have someone evaluate your movement, but then also look at you top to bottom. So we think about, maybe you have bone metastasis in, your pelvis, but your shoulder might be really tight, or maybe have dysfunction related to another breast cancer surgery, or because you've worked on a computer, or you fell off your bike as a child. So that supervised exercise really is ideal, but there are a lot of strategies that you can do at home. And you should actually try some of these things based upon how you feel in short periods of time. So I think it's really important that people start to feel comfortable moving and then reinitiate those kind of conversations, because that guided plan is going to get you there, really faster, or, at a more safe aspect. I think one thing, Kristin, that you talked about and I talked about as well, is how do you find somebody qualified? We said, definitely talk to your oncologist if you can. We have a couple of resources where you might be able to find somebody. But we do know that workforce development is definitely a focus of ours. In some situations, a community provider might work. It might, especially if you have somebody that you have a relationship with. But overall, given the complexity of your disease, having someone as your resource for supervised exercise would be ideal to managing your symptoms and side effects long term. And keep in mind that with metastatic cancer, things change. So tomorrow you may wake up and you feel terrible, or you may wake up and you feel super energetic. So be kind to yourself to know that even though you're striving to get more exercise, maybe get moving, follow up and go to physical therapy, some days it doesn't happen, and that is okay. So it is really important to kind of communicate that with your providers, but then also be mindful of yourself and how you feel, and just know that this is a long-term strategy and that you can manage day to day. And that's where these exercise professionals can be really helpful overall. Kristin, anything else to add that, thinking about the recommendations or anything kind of, as a guidance for our listeners today?
No, I think you summed it up really nicely there, Sami. I mean, everything is, you got to progress slowly. I think one thing we've realized, especially with early stage cancers, is, when treatment's done, you think I should be back to action right away. And you realize it does take some time and you have to build things up. And, if you think of Olympic athletes, they don't go from 0 to like 100 of their training. Everything's building back up, and slowly and steady is the way to go to just give yourself time for your body to adapt and reduce the risk of injuries and those sort of things. I think for people with bone metastases, the big thing we stress, as you said, is moving with really good movement patterns. And we all get stiff as we age, and, we get some funny little movements going in. And I think we really leaned on our osteoporosis colleagues. They have really nice resources about how to bend well and and just really making sure you're protecting the spine. And those are the things that we really recommended as well to get people moving in a really nice, safe way. We definitely took a page out of their book.
Definitely. Thank you. And I would probably add, people might say, just tell me what to do. And I will kind of go back to say, like, there's not really, with good movement pattern, of wrong exercise. We've seen people with bone metastasis run marathons. But, Here's the thing. If it's not what you want to do, don't run a marathon. Should you do yoga? Yoga is great for flexibility, may not build strength, but if you enjoy yoga, do yoga. So there really isn't a solid exercise prescription for anybody living with cancer, especially metastatic cancer. So find something that you enjoy, find something that you can stick to, and definitely, make this part of your regimen, because we know that it is going to be very beneficial to how you feel mentally and physically as well. So thank you so much for joining today. We will be putting some additional resources along with this chat today that you can use to follow up. And if you need anything additional, LBBC has a ton of tremendous resources, and I think is going to be very essential in building out this content for you as the patient. And we thank you so much for your energy and enthusiasm to exercise.